Good evening, everyone. What would you do if a loved one came up to you one day and told you that they were seeing swords coming out of the ceiling and that they were scared? Or you started noticing little behaviors that they didn't used to do before? Your loved one might be exhibiting signs of schizophrenia. Schizophrenia is a very serious brain disorder that is caused by genetics, different environmental factors, or even a brain abnormality. It changes how a person thinks, behaves, interacts with other people, or even expresses emotions. It is not split personality. That's a different disorder. The individual struggles to differentiate between reality and, imagination. A psychotic episode is when the schizophrenic individual begins to now lose touch with reality. It is the most chronic and disabling of all mental illnesses. They have issues functioning normally in school and other social settings. And it's a lifelong disease with no cure, although it can be controlled with proper treatment. Schizophrenia varies in intensity from person to person. Some people only have one psychotic episode while others may have several. They can lead normal lives between episodes, but these back and forths are known as cycles of relapse and remission. Now that you know what the disease is and who is susceptible to get it, let me explain the symptoms. Schizophrenia has a category of three types of symptoms: positive, cognitive, and negative. The prodromal period is the time before the onset of the full psychosis and when the symptoms start, which can last days or weeks. And those changes in behavior are very subtle. And they're also difficult to recognize because there's no specific trigger or trauma to instigate the onset of the episode. A positive symptom means that it is a symptom that's added to the individual's already current behavior that instigates an exaggerated or irrational thinking. Examples are delusions. They aren't based in reality, but the individual refuses to let go of whatever strange belief they're holding on to, even when shown facts. Hallucinations are sensations that aren't real. So either they're auditory, they may be visual. So they're either seeing things or hearing things that aren't real. And catatonia is when the individual is seemingly stuck in a fixed physical position for a long period of time. My brother went through that last year, and his last episode involved catatonia, where he stood outside in the freezing cold for hours on end and wouldn't move. Cognitive symptoms are those that affect the individual's ability to think clearly and react appropriately. Some of them include trouble focusing or repeated movements. He doesn't like to sit down anymore. He paces around all the time, and he struggles with his schoolwork because he can't focus on his textbooks. Negative symptoms are the absence of certain behaviors, which are normal behaviors, which are reduced energy, poor hygiene, lack of emotion, and withdrawal from family and friends. He doesn't really talk to anybody anymore. He keeps to himself. He keeps himself isolated, and he doesn't really show any emotion. Now that we understand schizophrenia, who can get it, and the symptoms associated with the disease, we can now see what types of treatment are available. Although schizophrenia cannot be controlled, it can be treated. One of the treatments are medications. Right now, or known as antipsychotics. Right now, he is on a medication. Since he doesn't take the pills, there's a new medication that's an injection that lasts 3 months. You also have social psychotherapy that can help the individual cope with behavioral, social, and even job-related problems related to the illness. The extreme cases may require hospitalization or electroconvulsive therapy. Electroconvulsive therapy is used 2 to 3 times a week, and the patient is put to sleep and then put into a convulsive state to help release some of the dopamine receptors in the brain. Now we're formally introduced and familiar with schizophrenia, and now you know how to cope with it if a loved one or you yourself are diagnosed. It's a serious brain disorder that distorts the reality of an individual. Through proper education, schizophrenia is a mental illness that the individual and loved ones of the sufferer can learn to cope with and adapt to. And although there's no cure, early diagnosis and treatment can prevent and reduce relapses of episodes and help the individual to lead a relatively normal life. Thank you for listening to me, and I hope you have a great one.